Okay, during the exam on introduction, I'm going to go ahead and enter the room. First thing I'm going to do is wash my hands, and next I'm going to start the exam with introduction. Hi, my name is Anissa. I'm going to be conducting your visit today. Can you tell me your name?
My name is Bryce.
Can you go ahead and tell me your age?
I'm 35.
And what brought you in?
A general physical.
Okay, and then did you find the place okay?
Yes, it was easy to find.
Okay, and then whereabouts were you coming from?
I was coming from Riverside.
Okay, and with that, I was able to see that he was in general good state of health. His habitus is within a larger build. Speech is appropriate. Sexual development is within normal limits according to his age. And his posture is within normal limits as well. During introduction, I was also able to see that his head is symmetrical, skin tone is even, as well as his hairline growth was even as well. With that being said, I can move on to cranial nerve 7 with facial expression. So go ahead and smile. Okay, frown. Go ahead and puff your cheeks and lift your eyebrows. Perfect. Okay, cranial nerve 5 is intact. Next, I'm going to go ahead and palpate the skull as well as the hair. I'm palpating for any masses, any tenderness, redness, scaliness, and then I'm also going to be palpating the temporal arteries, as well as TMJ for crepitus. So go ahead and open your jaw, close, perfect. And then next, I'm going to go ahead and check for cranial nerve 5. So with this, I'm going to go jaw movement up and down. Okay, so move your jaw side to side. Perfect. And next, I'm going to go ahead and get a cotton swab and just close your eyes and just point your finger where you felt it. Perfect. Perfect. So that lets me know that cranial nerve 5 is intact. Next, I'm going to go ahead and move to the neck. I'm going to check range of motion as well as tracheal midline. Okay, go ahead and move your neck up and down. Okay, side to side. Perfect. So both were within normal limits. Next, I'm going to go ahead and do cranial nerve 11. I'm going to go ahead and place my hands. Go ahead and push up with your shoulders. Perfect. That lets me know that cranial nerve 11 is intact. Next, I'm going to go ahead and palpate the lymph nodes. So we have preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, and then go ahead and shrug your shoulders. And then I'm going to check supraclavicular lymph nodes. After I do the head and the neck, I'm going to go ahead and move on to the eyes. So with this, I'm going to go ahead and do visual acuity first. So with this, I'm going to have him hold left hand to left eye and go ahead and repeat the line you see.
4, 3, 2, 1.
Perfect. And then go ahead and switch.
4, 3, 2, 1.
Perfect. Visual acuity is within normal limits. Next, I'm going to go ahead and check for cranial nerve 3, 4, 6, which is a extraocular movements. So go ahead and keep your eyes straight, or keep your head straight, move only your eyes, okay? Perfect. So 3, 4, 6 are intact. Next, I'm going to go ahead and do 2, 3, 4, which is accommodation. So I'm going to have you look at a far wall, and then I'm going to have you look at my pen. So ready? Perfect. Perfect. Okay. So 2, 3, and 4 are intact. Next, I'm going to go ahead and do pupil responses, cranial nerve 2 and 3. Perfect. So cranial nerve 2 and 3 are intact. I'm also going to be checking for lid lag. I'm going to be checking the sclera, making sure there's no redness, exudates that are expressed. I'm also going to be checking for corneal light response. Perfect. Okay, so next I'm going to go ahead and palpate the brows and lacrimal puncti. Perfect. And no exudates were expressed when I pressed on the lacrimal puncti. Next, I'm going to go ahead and move to the ears. I'm going to be checking for cranial nerve 8. So this I'm going to go ahead and whisper. Just repeat back what you hear. Oh, and then cover left ear. Yep, perfect.
1, 2, 3, 4.
Perfect. I'm going to do the other side.
1, 2, 3, 4.
Perfect. So that lets me know that cranial nerve 8 is intact. Next, I'm going to be inspecting the external ear as well for their symmetry and make sure that there's no redness. And next, I'm going to go ahead and palpate the external ear as well as the tragus and the auricle. Perfect. Next, I'm going to go ahead and move to the nose and sinus. I'm going to be inspecting cranial nerve 1. I'm going to have the patient tell me what they smell.
Peppermint.
Okay, perfect. So that lets me know that cranial nerve 1 is intact. I'm also going to be inspecting with the light lips, teeth, gums, buccomucosa, as well as stentons and Wharton's duct. I'm also going to be inspecting the hard and the soft palate as well. Okay, go ahead and open for me. Okay, so everything is pink, moist, no lesions, no redness. Tonsils were there as well. Cranial nerve 9, I'm going to be inspecting by having the patient say ah. Go open. Say ah. Perfect. I was able to see hard or soft palate and uvula rise. Next, I'm going to be doing cranial nerve 12. I'm going to go ahead and have the patient push against the wood with his tongue. Go ahead and push. Perfect. Perfect. Okay, so cranial nerve 12 is intact. Next, I'm going to have the patient move with feet on the side. Perfect. And with this, I'm going to go ahead and start with the thorax and the lungs. So with this, I'm going to go ahead and inspect the symmetry as well as the skin. The skin, the shape. I'm also going to be checking for respiratory effort, so ICS retractions as well as accessory muscle use. Next, I'm going to go ahead and palpate by symmetry of inhalation. So go ahead and take a deep breath for me. Perfect. And with that, I was able to see that my thumbs moved in and out symmetrical. So next, I'm going to go ahead and press on the spine. Tell me if there's any tenderness felt.
No.
No? Perfect. So there's no paraspinous tenderness. Next, I'm going to go ahead and check the costal angle. Okay. Okay, perfect. So both were within normal limits. Next, I'm going to go ahead and percuss by do the CVA tenderness. Tell me if you have any tenderness.
No. No.
Perfect. Next, I'm going to go ahead and palpate or percuss over the lung fields as well. And then go ahead and raise one arm up. Okay, perfect. And tympany was heard on percussion. Next, I'm going to go ahead and auscultate posterior breath sounds. When I place my stethoscope, go ahead and take a deep breath. Okay. ahead and lift your arm up for me. Take a deep breath. Perfect. Okay, so vesicular lung sounds auscultated. Next, I'm going to go ahead and have the patient turn back to the front. And next, I'm going to go ahead and auscultate anterior breath sounds. Deep breath in. Deep breath in. Deep breath in. Deep breath in. Okay. All right. Within normal limits, vesicular lung sounds were heard. Next, I'm going to go ahead and move to cardiovascular. With this, I'm going to go ahead and have the patient lay down, feet flat. So with this, I'm going to go ahead and inspect with the light. For PMI, I'm going to, for bounds, leaves, and lifts, bounds, heaves, and lifts, as well as JVD. Okay, and then go ahead and turn your head to the right. Okay, so no JVD, no bounds, heaves, and lifts. Next, I'm going to go ahead and palpate pericardium, PMI. I'm also going to be palpating the 5 landmarks, the atrial, pulmonic, Erb's point, tricuspid, and the mitral valve. So, and then I'm also going to be palpating the carotid arteries as well. So carotid arteries being palpated. Go ahead and turn your head to the left. Okay, head to the right. And then I'm going to be palpating for PMI, as well as the 5 landmarks: atrial, pulmonic, Erb's point, tricuspid, and mitral valve. So next, I'm going to go ahead and auscultate with the bell of my stethoscope for Ruiz on the carotid arteries, as well as listen the bell and the bell for the 5 landmarks. Okay, go ahead and turn your head for me. Turn your head. Perfect. Now I'm going to do the 5 landmarks. So you have the atrial, pulmonic, Erb's point, tricuspid, and mitral valve. Next, I'm going to switch my stethoscope over and do it again. Okay. So with with heart sounds, there was no murmurs or extra beats heard. Next, I'm going to go ahead and do the peripheral vascular system. So go ahead and sit up for me. Okay, and then with this, I'm going to go ahead and inspect lower extremities. I'm going to go ahead and inspect for color, edema, and hair distribution. Next, I'm going to go ahead and palpate both upper and lower extremities for a cap refill, as well as the different pulses. So let me see your finger and toes. Okay, cap refill is less than 3 seconds. Next, I'm going to go ahead and palpate the different pulses. So we have brachial, then we have radial, and then go ahead and lay down for me. And then we have femoral. And then I'm going to be touching the top of his feet. That'll be dorsalis pedis. And then I will be touching at the sides of the ankles for posterior tibialis. And then popliteal, just right underneath the knees. Okay, perfect. So all pulses were strong, even. Next, I'm going to go ahead and inspect the abdomen. With this, I'm going to have him remain laying down. And then, so first thing I'm going to do is I'm going to lift his shirt and go ahead and look at the skin, contour, and any aortic pulsations. Okay. Okay, so skin color is with the normal limits, no aortic pulsations, and contours with the normal limits. Next, I'm going to go ahead and auscultate the 4 quadrants. All right, so all 4 quadrants were auscultated. Next, I'm going to go ahead and percuss all 4 quadrants. Okay, and next I'm going to go ahead and do softly palpate and deeply palpate. I'm going to feel for any masses, feel for any if he has any tenderness. So just tell me if everything feels okay, no pain.
No pain.
Okay, so next I'm going to do deeply. Might be a little uncomfortable.
No pain.
Okay, perfect. Next, I'm going to go ahead and move to musculoskeletal system. So go ahead and sit up for me. Okay, and I'll have you go ahead and sit down for me. Okay, with this, I'm going to inspect different joints. So I'm going to inspect the fingers, the wrists, knees, ankles, as well as the legs. So go ahead and, so I'm going to check for any edema, redness. Go ahead and press against my hand. Perfect. Push up. Perfect. And push up. Perfect. Go ahead and give me your hands. Any tenderness? No.
No.
Perfect. Next, I'm gonna check for his shoulders. Go ahead and put your shoulders out and do windmills. Okay, so no tenderness, no edema was noted. Next, I'm gonna go ahead and with the knees. So go ahead and lift up. Perfect. And move your leg out. Perfect. This, lift up, lift out. Perfect. No crepitus, no edema, no tenderness noted. Next, I'm going to go ahead and move to his mental status. In the introduction, I was already able to notice his appearance, his behavior. So next, I'm just going to inspect cerebral function by Romberg. Go ahead and sit up and keep both hands by your side. Close your eyes. Perfect. Go ahead and sit back down. So that was a negative sign. Next, I'm just, gait assessment was appropriate as well. Next, I'm going to do deep tendon reflexes. Perfect. And that is the end of the exam.